good afternoon and welcome everybody. My name is Roisin Delaney. I'm the editor of the Cannabis magazine, the UK's first CBD and medical cannabis publication. Thank you to the ACI and the Centre for Medicinal Cannabis for arranging today's event. Over the course of the next 90 minutes or so, we're going to be hearing analysis of the recently published Green Shoots report, which has everybody talking in recent weeks. Before we get into it, I'd like to welcome and introduce Steve Moore, Strategic Counsel and founder of the CMC and ACI. Steve, welcome. What kind of event do we have in store for us today?
Thank you. Yeah, thank you. Yeah. So I suppose so first of all, thank you for everyone who's joined us today from around the world. Thank you for finding the time for this event. I hope you find it as interesting as we have found it in terms of the development of this report that was published a couple of weeks ago. I suppose the way I would contextualize this is by saying, imagine if we were to roll back 3 years to this conversation. And this is a conversation that we're having today that we couldn't have had 3 years ago. 3 years ago, you couldn't, if you'd attempted to prescribe cannabis as a doctor to a patient, you could have ended up in prison. There was no approved cannabis-based medicines approved to be prescribed in the NHS, and the MHRA was pursuing a rather doom-laden attempt to regulate CBD products in the market, which failed lamentably. So in a sense, what we have since then, over the course of the last 3 years, through the work of activists and companies like the ones on this call today, we've actually been able to create something of a market, cannabinoid market in the UK, one where people can be prescribed cannabis-based medical products, one where the NICE is now approved products to be prescribed in the NHS, and where the Food Standards Agency are busy at the moment assessing hundreds of dossiers that have been submitted to them by scores of companies to seek formal novel foods approval. So we've seen an awful lot of developments over the course of the last few years, which have happened, I think, as we describe, I think certainly I described in the preface to this report, is happening in a very sort of different way. So if you're kind of taking a kind of helicopter view of this industry, you see things happening in a very slightly incoherent way, a slightly disparate way, and in a sense, people having to react to events, campaigns to very powerful emotional campaigns to legalize medical cannabis, a huge growth of a grey market in CBD, and hundreds of millions of pounds being invested in products that eventually became licensed and then approved for prescription in the NHS. So a lot has happened in the last 3 years. So in a sense, this is a taking stock report that we wanted to publish, because what we wanted to assess in this report is to look at the whole contours of the industry, particularly given from a public policy perspective, because really at this very, very early stage, this industry is still very much a political game. It's very much, its destiny is entwined to some extent, a heavy extent, I would say, by public policy developments. Yeah, so it's not an industry that can basically free flow. It requires political and public policy interventions to allow it to grow and to flourish. Now, we've seen some of those things happening over the course of the last few years, as I've catalogued, but there's a lot more that needs to be done. And really what we were arguing for in this report, and this report, I should say, is a reversion of a submission that we made to the Prime Minister's Task Group on Growth, Innovation and Regulatory Reform. And that will be published, that report will be published in the coming weeks. And we're hopeful that we are now going, some of our recommendations are now going to be included in that report that goes to the Prime Minister. But what we were trying to do, the ambition of this report was to say, this is a big growing industry. This is an industry that basically has a potential to generate jobs and support the development of new businesses in the UK. It's here to stay. And we need a public policy footprint in Whitehall and in Westminster to support that, yeah. So it can't be done. We can't continue with this kind of slightly disparate, disconnected, kind of reactive interventions from government and from regulators. What we need is a much more coherent strategy for cannabinoids in the UK. And the two things that we've been able to say in this report and convey to government over the course of the last few weeks is both the size of this market and its potential, but also the advancement of the regulation that's taking place at the moment. There's nowhere else really in the world where regulators are actually assessing for approval consumer cannabinoid products. That's not really happening anywhere else. In the US and the EU are still somewhat behind what's happening here in the UK. And also we've got this hugely buoyant market, probably second only to the United States. People like these products. They keep on to buy these products. They've survived all the economic restrictions applied during the course of the pandemic. People have come out the other side. This industry is buoyant, it is growing, and it seems to me that as the country starts to focus on the economic recovery post-COVID and the UK context post-Brexit, and the focus is increasingly on life sciences and nutraceuticals, that this is a sector that should have its own footprint, that should speak with a voice, a coherent and call for coherent regulatory reforms. And the report that we published is packed full of those kind of ideas. Every idea that we put in each of these 20 recommendations that Parveen and Andy and Daniel will speak to a potential intervention in public policy that will help this industry grow, help this industry flourish, and it will basically, hopefully, help it consolidate and build upon the first mover advantage that improbably we've got here in the UK because of some of the work that we've done here at the CMC and the ACI, and many of the companies who are on this call have been able to support us with. So I think we are in a very interesting position at the moment. We've made some progress, significant progress. As I say, it would be unimaginable to have this conversation 3 years ago, but what we now need is more firmer foundations upon which to begin to build this industry. So over the course of today, you'll hear from the authors of the report. You'll have a response from the industry itself, from clinicians working in the industry, from investors in the industry, and hopefully we'll have a really constructive conversation. Please, if you don't feel that any of your questions have been answered, or you have any further issues that you want to raise, or ideas you want to share, or questions you want to probe, don't call them today, do contact us. We'll be able to contact Victoria and the team who've put this event on, and they'll be able to help you. But that's my introduction. I'm delighted and delighted that Roisin has taken the chair for this event, and I'm going to hand over to put you now in her capable hands. Thank you.
Thanks very much, Steve. Thank you for that great introduction. You really just summed up why we're here and how hopeful we are for the future. So as Steve said, let us know if you have any questions. Get your questions to us via the Q&A box, and we'll try to get to as many of them as we go through the various different sessions. I think Steve has brought us nicely into our first session now. So let's talk numbers. A survey completed by Public First and published a few weeks ago in April found that the consumer cannabinoid space is worth £690 million, $1 billion. So it's only right that we begin today's event by hearing from Director of Public First, Blair Gibbs. Welcome, Blair.
Hi, nice to see you.
Thank you for being with us today. Do you want to kind of just take it away and tell us where these numbers have come from and, you know, how positive it is for the industry in the UK?
Yeah, absolutely. So one of the things that we were quite keen to do with submission to government was to try and put some numbers to this industry so that the government would get much clearer sense of how important it already is. And many people on this conference will have read or been aware of the report that the CMC produced getting on for almost 2 years ago now, back in the summer of 2019, where we invested some resources at that time in doing what we thought was the first most comprehensive market sizing for the UK. And that was a number that was big at the time and was seized upon and has been repeated in many places ever since as a very strong and robust calculation for what the CBD market was worth. But that was, of course, 2 years ago, and many people understand how quickly this industry moves and how much the market itself is developing over time. And so we were very conscious that if we were making representations at this point, it would be really an advantage to try and update those numbers and give and give people a better sense of just what the CBD market is worth in the UK today. So if we go to the first slide. So I just thought for some context, we should say that I think there's essentially 3 reasons why, if you're looking at the UK from an international perspective, why has the UK had this unbelievable boom in CBD? I think the first thing to say is that there's obviously been for some time very strong retail penetration of CBD products, both in high street stores, national brands and other supermarkets stocking it. And of course, the UK itself is a very high spending online shopping nation, and has been for some time. Those numbers, by the way, are increasing every year and have surged during the pandemic. And of course, as we knew from the 2019 report, many people do buy their CBD products online. I think the second factor which explains the huge market here is that, unlike somewhere like Australia, CBD was never classed as a controlled substance here. There's been this grey market developing, and the enforcement has been very limited or completely absent. There are only health marketing restrictions, as people know, and there aren't really any retail access controls. Anyone can buy it. And then lastly, this consumer appetite for it. So I think it's fair to say that British consumers have embraced CBD as a product category. We know from our own surveys that people tend to repeat buy, and it's obviously been established, as part of the broader wellness trend which has developed over the last few years. So I think those reasons alone are the most important ones for explaining why this CBD market is so large. The question is, how large is it? Move to the next slide. So one of the things we said in the report is that there has been no good estimate really of the overall worth of the cannabinoid sector in the UK, and if that was to encompass both hemp and medicinal and pharmaceutical cannabis. There is no single assessment of that entire sector. We know that the CBD part of that broader sector is one of the most important. And again, some of the existing estimates that are out there have often, for example, used surveys that are based on self-selection or on people who are already CBD users. So we wanted to make sure that any survey that we did that was forming the basis of a CBD market size was not was going to be representative of the UK population as a whole. And as I say, the best one that we I would say this, wouldn't I, that we were involved in producing in 2019 with the help of Navigant Research, used survey responses from Dynata, and that was the basis on which we were able to understand consumer purchasing habits, how often they bought, how much they spent, but also on a general survey population basis, how many people claim to have used CBD in the last year. So on revisiting the same survey methodology, but with 2 new surveys in the UK, both conducted in April 2021, you can see from the chart here that we're plotting with a new orange bar the updated calculation. The blue bars on that chart refer to the projections based on those 2019 numbers. So back then, we estimated that the CBD market was worth around 300 million a year. That's a figure that many of you might be familiar with. That it would increase to a little under 400 million last year, and then it would jump to a bit over 500 million, 526 million this year. Our estimate currently is that it's more like 690 million, and I'll explain a bit more about how we arrived at that. So here we are. This is essentially the sort of geometric average of the 2 estimates. So with surveys of this scale, although they're representative of the population, slight changes in how questions are worded can yield slightly different results, which when extrapolated can give you different outcomes. But the essential point here is that we've been quite conservative in our assumptions here, and we didn't change any of the other assumptions going into the Navigant sizing work from 2019. So we think that they're both relatively conservative estimates and also comparable to the work done in 2019. So 693 million is the figure we estimate now as the average for the value of the sector today. Here is one of the questions that was in the survey which led to the calculation. As you can see here, the number of people who spontaneously say that they've tried or used or purchased CBD in the last 12 months. So it's 4.2% of those respondents in that survey. And then in the second question, we asked, have they purchased a CBD product in the last 12 months? And gave them prompts as to what type of product that might be. That gets a slightly higher percentage as well. So 8.2% for respondents in that question. So in the first model, we did some adjusting for over-reporting, as was done in the original Delaney survey. And we maintained the average spend per user. So there's a question mark there. People may have their views on whether or not that's valid. Again, what I will say is it's very hard to get decent data on spend by consumers in niche categories that are this specific. So we thought it best to maintain the figure used in 2019 in order to gross up the market value. But I think many people would argue that in fact it's possible that during the pandemic people were buying more or at least spending more. There's also the alternative view, which is that generally the market's become more competitive and prices have gone down somewhat. So perhaps the annual spend was the same or less than was the case in 2019. We would need other methodology to tell us that. So I think the implications here are twofold. Firstly, that the UK CBD market is clearly large and continuing to grow. And the second is that the policy imperative here is quite clear around the need to regularize. So when we did the CBD in the UK report in 2019, we were skeptical then of the idea that the CBD craze that was being sort of discussed in the media was just a fad. I think we can now conclusively say that CBD in the UK is not a fad. Clearly people continue to buy it, continue to be introduced to it, continue to take some benefit from it, and then go back and spend more as a repeat consumer. So the other thing to say is that the data is as good as it can be at this point. I think current estimates based on survey data alone are good, but they're not quite enough. If we had actual data on spend and on product categories, and if some of the largest CBD companies in this space were sharing more of their data around their product categories and what's most popular, that would give us a bit more of a richer picture in terms of what is being bought. And I think we still don't know enough about CBD consumption patterns by individual consumers, so their age, social class, what product categories they are gravitating towards, whether there's been a move over the last year or two, either towards certain types of products like vapes or indeed away from them. That's still data that we don't yet have, and it would be a real benefit to the industry if somebody were to do those sorts of analysis. And then, as I say, the second implication I think, which is really important, is that despite the growth of this market and how big this industry now is, I still think that makes the case even stronger for what we argue for in the report, which is that it's really, the onus is on the government and regulators now to make the CBD sector fully regularized. So there are clear compliance rules, labeling standards, product authorization paths we now have with the FSA. But we need those consumers who are spending money in this large and growing market to be protected, and we want competition to be fair between companies. And then the last thing I'd say is that I think clearly the British consumer is becoming quite experienced with CBD in a way that it's, for example, not possible to be in parts of the world So it may be that over time they become increasingly discerning, that they'll want higher quality CBD products, that they'll expect a degree of traceability that isn't there at the moment. And they may even be very receptive to arguments or brands that promote provenance, and therefore the issue of British grown cannabinoids and CBD extracted from British grown crops, and what's needed to make that a possibility in terms of law and regulation is, I think, something that the industry should be paying more attention to, because I think it will eventually become something that British consumers look for and are prepared to pay more for. And that's all for me for now.
Thank you very much, Blair. Blair Gibbs there, Director of Public First. And I think what's really interesting to see is where we've come from in a time where CBD was very much, we won't kid ourselves, it was very much considered a fad, you know, back in kind of early 2018. And then all of a sudden it started to appear on the shelves of well-known high street retailers, and it became, you know, this very kind of niche alternative, I suppose, healthcare product. And now we're seeing it alongside product categories like protein powder. You know, it's really interesting to see how far it's come in the last kind of very short space of time, in 3 years. So we've progressed now, I suppose, into, would you think it's fair to say, into the adolescence phase of the consumer kind of cannabinoid market. Where, you know, from your point of view and from a data point of view, do you think we're going next?
I think one of the things that the industry will know very well is that the growth of CBD in the sort of wellness space provides lots of alternatives for new product categories. And I think the one thing that at the moment is maybe restricting or limiting the ability of some of the CBD brands to sort of promote new innovations is this sense of legal uncertainty that still pervades the CBD sector. And I think one of the things that we talked about in the report is the sort of gradual admission by the government and by regulators that this is not a market that you can put back in the box now, even if you wanted to, that it's here to stay, that it's very large, that it poses no health risks, and that it's important that consumers get sort of the protection that they deserve, and that the grey market element needs to be squeezed out. And the only way to do that is to be very clear about, you know, its legal status, but also it's you know, these are the companies that qualify, these are the companies that can meet the standard in terms of, you know, trace THC, etc. And I think over the course of this year we'll get that, and that will encourage more of the bigger CBD companies and the companies with the larger marketing budgets to sort of think more proactively about how they promote their products. It will remove that hesitancy that I think there still is in many of the sort of mainstream supermarkets and other retailers for actively promoting CBD in the way that they might otherwise choose to. And I think that will again raise further awareness as that starts to happen. People will hear about, you know, different types of CBD innovation. There'll be more advertising, and that will help to drive up consumer demand as well.
Fantastic. And I suppose one of my other kind of questions for you would be, you know, in terms of provenance and British made or British grown and the British sector, we know how fruitful it has the potential to be now. And we know that regulation is starting to come into it now, thanks to the Novel Foods Directive and so on. I suppose what I'm asking is, do you think that if we create that kind of a bubble here insofar as we think we can, you know, will that stand the test of time into creating a sort of reputation for British made CBD in other parts of the world? Can we set a standard and be that global standard, do you think?
Yeah, I mean, I think that the sort of goal is laudable, and I think it's up to industry to sort of strive towards that. I think those companies that are based in the UK that see that as the added benefit for their own consumer base now should also be thinking about what the export potential would be. So if they were able to source their CBD entirely in the UK, have it processed and extracted and purified here, then I think that would be something to you know, justify as a premium when you're exporting that to the rest of the world. We have this, crazy situation, as everyone will know here, of being one of the largest exporters of medical cannabis for licensed pharmaceuticals, and yet at the same time, simultaneously, probably one of the largest importers of raw material for CBD consumer products. So ideally, we would be in a position where we're exporting a lot on both fronts, but there's also a huge amount of domestic demand for CBD, and I think, generally speaking, if you look at other products in the sort of nutraceutical space, it's never a disadvantage to be able to be very local and to be very clear about traceability and about how the product's origins are somewhere identifiable and ideally nearby. So I think the advantage for the industry from locally grown CBD is very strong. It won't necessarily be the source of everyone's future sort of product lines, but I think it will be something that can be exploited by those who choose to, and at the moment, of course, prevented by law from happening. So I think collectively the industry as a whole would see some benefit in how, having those regulations changed, which is one of the things we argue for in the report.
Fantastic. Thank you very much, Blair. Thank you for your slides as well. And just to let people know, anyone who missed the start of Blair's session, you can access everything that is going on today from our fantastic event this afternoon afterwards on demand on the ACI or CMC website. So don't worry if you've missed anything, if you missed the first 5 minutes or you missed something crucial and came into one of Blair's fantastic slides there halfway, you can access this after the event as well. So thank you very much, Blair Gibbs, Director of Public First. And we are going to move on now to our next session, which is our first panel discussion of the afternoon. This panel is going to look at the key recommendations outlined in the recently published Green Shoots report. Welcome to the ACI's Regulatory and Compliance Lead, Dr. Parveen Bhatarah. Dr. Andy Yates is also here, the ACI's Pharmacy Associate and the Centre for Medicinal Cannabis Pharmacy Lead. And welcome also to Dr. Daniel Couch, who is the Medical Lead at the Centre for Medicinal Cannabis. Welcome to you all. What an exciting afternoon we have. I can't wait to pick your brains on some of the key recommendations. Now there are 20, so we're going to try and get through as much as we can. But Parveen, if I can come to you first, please. Would you take us through the recommendations from the Green Shoots report pertinent to the consumer cannabinoid space, the CBD space, if we start from there?
Yeah, sure. Thank you very much, Roisin, for giving me the opportunity to discuss the key recommendations. I will take a deep dive into mainly the consumer cannabis sector, especially the CBD sector. As we all know, the CBD sector is a real asset to UK, which needs to be supported and nurtured. And especially all these recommendations have come about with our experience in working in the cannabis pharmaceutical sector for over 12 years, as well as 18 months in the food sector for the CBD. And personally, especially having set up the UK's consortia, I was really disheartened not being able to set up a consortia for using the full spectrum CBD, because legally we were not allowed to use that, and we had to use the broad spectrum tox studies on the CBD. So all these things has a personal implication as well as for working in this sector. So I'm going to just take a deep dive in such a way so that I will be covering from the life cycle and the supply chain of the CBD as it affected the whole industry. So as we all know, there was a lack of enforcement. We cannot go on like this. Luckily, we have now novel food application, which is bringing a compliance to the sector, but still, because there is issues and challenges and the regulation which are creating a wedge between the synthetic derived as well as the plant derived CBD. In order to alleviate that, we are recommending that key recommendation I have not put into the order. I'm talking in the order as it starts from the bottom of the supply chain, the key raw material, right up to the finished product goods. So first one, there are EU approved strains, which can be only used for the CBD sector. And post-Brexit, we have to use and evaluate the new strains, evaluate that. The innovation in this sector is so important. To translate this innovation into the commercial as well as the pharma application is required. So we recommend that sector needs to be looked into. Along with that, at the moment, we are only allowed to use flower or leaf. But in order to allow this sector to be nurtured, I think if we recommend that if the MDR regulations are amended so that in the hemp sector, farmers can allow to grow these hemp plants, but they can sell or move over these flowers and leaves to the licensed processors so that industry can be proportionate and robust and formous so that we can remove the non-compliant actors from the market. So in this way, we are maintaining the law as well as we are using the whole plant in this sector. Regulators, MHRA and FSA have tools in their hand which they can now implement. In the commercial sector, as Blair mentioned, that quality, we need a significant support from the industry to maintain the quality because we don't have any standardization and harmonization for testing quality. So we need the assistance on the quality, labeling, as well as then testing. So in order to have that compliance sector, we recommend that there should be a licensed UK labs. In order to enforce this, we feel that currently, as the law stands, there should be availability for the 0% THC reference standard so we can maintain the current law. However, we are also recommending as part of our THC paper, as was our discussions, ongoing discussions with the Home Office and the ACMD, that we're recommending that limit should be increased to 0.03% with respect to the CBD, so that industry can be automatically coming to compliant when they have a necessary measure to measure and obey the law. The suppliers can retain, suppliers and retailers should actually use the UK tested lab materials only. This will not only increase the compliance, this will also increase the employment in this sector. And also what I have found out that there is such a lack of skill set in this sector. In order to nurture this sector, we need to increase the skill in this sector. Although, as Blair mentioned, that we are exporting at the moment over 90% the raw material from outside UK. As a result of that, we have lost the skill set here internally. In order to nurture this sector, we need to have that skill set. So having a UK testing laboratory will assist us significantly in this sector. At the moment, we know that to be compliant for the CBD, we should have almost 0% THC in the finished product. But we feel that if these limits, as we proposed in our THC paper, that gone up to 0.03%, that should assist the CBD industry to be compliant. And with this increase in limit, if we can exempt or government can exempt the CBD compliant products under Schedule 5 rather than Schedule 1 under the MDR regulation 2001, this will assist the industry significantly and also streamline the industry and much more trade in this area. There is a great need for reform in the license strategy here. We need to be having a modern and much more transparent licensing regime in this sector. In order to have that, as we all have experience in this sector at the moment, in order to get a license, we have to go through a significant hoops, maybe a couple of years, or even in some cases, I have got examples of 5 years. Companies have lost out on a significant projects and trade because they haven't been given the license. So, but it will be very helpful if government can streamline this licensing regime. And we recommend that maybe having a very basic license, which can be for the R&D studies in the universities, followed by a very light touch for the industrial hemp farmers. And then the second sector, we are saying the high THC plant for the medicinal needs, and finally the non-controlled cannabinoid for the consumer sector. So these sort of three licensing regime will suffice every need and actually fast track the licensing opportunities. And finally, we recommend that Department of International Trade should assist the CBD industry in global export. Having the homegrown industry, this will, so far we've been importing most of the raw material. But if we can have an opportunity to have a homegrown industry, and let's build on the guidance to export globally, that will be the fantastic position to be in. Let's have a UK as the innovation center for cannabis, so that where consumer can have absolute confidence in the supply chain available from UK high street cannabis-based consumer product, CBD-based consumer products, and have a confidence in quality, and that will be really helpful. That's all from my side on the CBD sector. Thank you.
Thank you very much, Parveen. And I think that's been, there's a lot to kind of, take in from this report. And it's really meaty, which is fantastic to see. And I think especially from the research and development side, I think that's something that a lot of our panelists this afternoon are looking to touch on. So thank you very much for your insights in terms of the consumer kind of cannabinoid CBD space, Parveen. We'll move on now to Dr. Andy Yates if we can. But if anyone does have a question for any of the points raised in the key recommendations from Parveen, please just drop us a quick question in the Q&A box and we will try to get you an answer by the end of this panel. Dr. Andy Yates, you're here with us this afternoon as well, Andy. If we can potentially just zoom in on the UK position, I suppose, that we find ourselves in now. How do we embrace and nurture this precious cannabinoid sector that we have here domestically and turn it into that global hub?
Thanks very much, Roisin. And maybe we could just go back on a slide. I know we want to put these up. I will ask for the slide to be moved forward, but as you say, my sort of take-home messages on the recommendations we've made were relating to three sort of key facts, really. That the UK, as it is even today, is a great place to come and do legitimate cannabinoid business setups and R&D, and as you've heard extensively from Blair and Parveen, we've got a flourishing consumer cannabinoid sector exemplified by our CBD market. So the UK was the first country to burn out a licensed cannabinoid product through GW Pharmaceuticals, which has now been sold $7 billion to Jazz. We have a flourishing CBD market. We have a financial regulator that recognizes the validity of cannabinoid based companies being listed on the stock market. And We have an excellent academic network exemplified by Aberdeen University, Nottingham, Imperial, King's, and others as well that are world leading in cannabinoid research. So I really think that some of our recommendations to the government and to the wider public is to sort of cement that position, to make the UK the place to come and set up innovative, legal and ethical cannabinoid businesses in whatever sector that might be. The second point, I think, to get us there, and you can see in the first 4 recommendations, which are all to the government, is that in order to cement our position in the world as a global hub, is that the UK government needs to be confident that it can sell UK PLC as a place to come and do cannabinoid business. And I think it'll do that in a couple of ways. It really needs to understand itself what cannabinoids really means in the non-recreational space, because as you'll note in our report, for those that have read it, that we are not advocating the transition to a recreational cannabinoid market. But in order to understand the space, we'll obviously give them confidence of that backing it, supporting it, and promoting it in a worldwide sense. And we've actually hit upon this problem ourselves as the CMC and ACI, all of us who've been working in the sector for many, many years, myself over 20 years actually. It's a very complex space to understand, where, you know, and the model I use is that you can have a bottle of CBD, and depending on what it says on the label, it could sit in the consumer cannabinoid sector, where we're talking about nutraceuticals and wellness. It could sit in the specials market, where the medicine is being prescribed by a doctor under a prescription out to a patient. Or it could sit in the licensed sector, known as Epidiolex, pretty much the same bottle of medicine, same CBD in it, but it sits under 3 separate regulations. And that is a cause for confusion, both within the industry itself, to the consumer, and importantly at this point of our deliberations with the government, to the government. So we really need to get the government to understand the sector. And as you heard from Blair, and I was part of the Navigant 2019 report, actually understanding the value of this sector is extremely complex. And I think we pride ourselves at the CMC and the ACI that, you know, we will only stand behind numbers that we're confident in and have been well researched and well have good models behind them. So you can see actually that, you know, number 2 and number 4 is to encourage the government to actually understand the value of this segment itself, because we believe once they do, they will find it a lot easier to loosen and change the regulations to ensure that those sectors can grow. And the final point, which will lead on to a couple of the other recommendations, is that the current situation, depending on which segment I described before for this same bottle of CBD, the Home Office, which primarily has a role to sort of protect the citizens of the UK, is the ringmaster for all of these different segments. And as you'd expect, it's got a tough job to actually get that right in each section. So our encouragement to set up a national cannabinoid control authority, which would fundamentally be in charge of the licensing regime that Parveen described earlier, is an essential part, we believe, to move us away from a point where cannabinoids are seen as only as drugs of abuse, controlled substances, which is how the Home Office has to see them, to a place where a national cannabinoid control authority can understand the commercial and consumer and patient benefits of the cannabinoid and see it outside of the context of just being simply a controlled substance. In order, we believe, to help the National Cannabinoid Control Authority and the UK PLC to become a hub of where to come for your cannabinoid businesses, recommendation 10 is that a long-held belief from us within the CMC at least, that the government should fund a dedicated centre of excellence. Now, this centre of excellence may be in itself a standalone unit or centre, or it could actually just be a virtual centre of excellence, which coordinates many of the excellent academic centres here in the UK to do research that is really going to propagate and move forward the whole cannabinoid science sector. And the way that we see that falling out, and you'll see this in the report, is that the National Cannabis, the Centre for Excellence, would primarily be driven in three sort of sectors: preclinical science, clinical science, and social science. And through having a nationally approved Centre of Excellence, the data that we know is sometimes lacking to move our sector forward would be generated within this Centre of Excellence. It could be crop science, it could be analytical science that Parveen said. It could be delving into the clinical data to understand the potential benefits of cannabinoids for patients. It could be understanding how black market cannabis use could be attenuated by more access to better cannabis medicines here in the UK. So we really believe that the centre of excellence, if you wish, is the hands and the body of the National Cannabinoid Control Authority. So whenever it has a question or a doubt about are we going too far here, it can turn to the Centre of Excellence to help answer that question. If you move us on to the next slide, I'm just going to cover off one more recommendation before I hand over to Daniel Couch to take us through more of the medical side of our recommendations. But if you look at recommendation 18, our body that advises the Home Office back in 2017 actually said that when cannabinoids are being used in research, legitimate research by academic units or businesses that want to generate data of cannabinoids, that they should not have to jump through the hoops of being a Scheduled 1 drug. And although the 2018 amendments somewhat go to alleviate some of those problems, in reality, it's only at the point where you're in a clinical study that actually cannabis-based medicines would turn from a Schedule 1 to a Schedule 2. And there's a whole host of reasons why compounds that sit within the Schedule 1 regulations are a very, very big challenge to work with and research. I'm a recipient of that pain, if you wish. I've lived through it. So we believe that actually by helping the government say, there's a place for legitimate research of these compounds, and there's a way you can do it recommended already by your own advisory committee, we believe that that would encourage more pharma type companies coming into the UK to do their research here. So with that, and with hopefully a good explanation of how we think our recommendations are going to lead the government to act and behave going forward, I can hand over to Daniel now to talk through some of the potential upsides of these recommendations in helping in the medical sector for cannabis.
Thank you, Andy and Parveen. I think I agree with everything that you both have said. And of those of you who know me or worked with me before, I'm a medical doctor working firmly in the clinical space. And from working in this landscape for the last 6 or 7 years or so, I think that the ground really is shifting below our feet. And what I mean by that is that attitudes towards the research and prescribing of medical cannabis, but also the use of nutraceuticals in this space has shifted. And we have two choices. We can either just let it happen and let our attitudes go where they'll go with the tide, or we can be decisive and we can set a strategy to make the UK, as Parveen has said, to make it the sort of the international hub of cannabinoid research, the place where people come to describe and to dictate what happens in the cannabinoid sphere. And the UK is exceptionally well placed to do that. We already have the research pedigree spanning back 2 centuries, where we have been setting the agenda with research strategies for novel therapies. We already have the blossoming industry, and I think that our attendees today are a testament to that and to our panel. And more importantly, more recently, there's a growing political will. Cannabinoid science and the cannabinoid industry is now on the political agenda. Whereas 7 years ago, when I started in this landscape, cannabis was essentially a dirty word, and people were sniggering into their sleeves when you mentioned cannabis. And that's no longer the case. We know that it's now on the agenda of Westminster at number 10. And I think this report crystallizes all the things that we have been thinking and saying for the last few years as to what needs to happen to set the pathway for cannabinoid regulation and innovation over the next few years. And I think this report does that really nicely. It's very difficult to, I can't improve on some of the things that Andy and Parveen have already said. I think it's clear that generating the right innovation, both in the industry space and in the clinical research space, is really important. And classically, the way that research has occurred has been in a very haphazard way. And what I mean by that is researchers who have an interest in cardiovascular disease will research cardiovascular disease. And let's say there's a cannabinoid researcher who has an interest in cardiovascular disease, that's what they're going to research. But that may not be, that's a very good thing to research, but that may not be where the real fruit lies in cannabinoid science. And I'm not saying that that's not where it lies, but what my point is that we need to set a strategy for where we are going to commission research. And we can do that through through generating a cannabinoid research authority, which this report recommends. And then we can really set things to achieve in the research sector by allocating the research resources and the industry resources in the appropriate way, rather than in a slightly haphazard, researchers in a sort of meandering way researching what they find interesting, but actually there may be other things that are more beneficial for the population at large and for the industry at large. And I think bringing all the resources together to set an agenda and a protocol for how we approach these problems, I think is very important and is set up very nicely, as I say, in this report. Obviously, my passion will always be researching the medical applications of cannabis, in addition to nutraceuticals. And I can't really improve on what Andy has said in that regard, and Parveen. And I think to save me filibustering for another 5 minutes, I think, I know we're out of time, or 5 minutes over time, but for me, that's where the value in this report lies, because it sets very clearly where we should be going over the next 5 years.
Thank you very much, Dr. Daniel Couch, medical lead at the Centre for Medicinal Cannabis, for wrapping us up there. And I think, in the interest of time, we'll move on swiftly to our next panel. But as I said, if anyone does have any questions that you would like to put to any of our panelists this afternoon, please just put those in the Q&A box on your Zoom screen. So we will move on next to our third and final segment this afternoon, in which we will examine the industry response to the position we find cannabis in. How we, industry stakeholders and advocates, can take action to really push for growth and development and refocus as we come out of this post-pandemic and post-Brexit era. So please a big welcome to our panelists, Moyra Cosgrove of Naturecan, Dr. Elizabeth Phillips, neuroscientist and CBD expert, Kingsley Wilson of Crystal Capital Partners, and Ed McDermott of EMEC Life Sciences. Welcome to you all. And I know we've been through so much in the past hour. So Moyra, if I can come to you first and specifically just ask you about Naturecan's response and approach going forward.
Sure. Good afternoon, everyone, and thanks very much to the CMC for giving us this opportunity to feed back on this incredible report from our point of view, from the industry point of view, and particularly from Naturecan. I'm head of nutrition at Naturecan, and the first thing I want to emphasize is the excitement around this sector at the moment within the industry. It's palpable everywhere you look, certainly within Naturecan, but I feel it outside with other consortium members that I've met through the ACI. And in this post-Brexit and post-pandemic period, it's really exciting to look forward to a prosperous future for the UK, and that includes this consumer cannabinoid sector. So who could have predicted the growth that we've seen over the last, recently over the last year or two? It's just gone crazy, and it's taken everybody by surprise. But there's much, much work to be done yet. And this comprehensive list of recommendations from the ACI and the CMC is a great start to really ensuring that this industry can flourish and move forward as it should do, because it's in the interest of consumers, and of course it's in the interest of the companies involved in the sector, not to mention the UK moving forward, for the economy of the UK recovering from the pandemic. So I could have gone through all 20 recommendations and said something positive about them, but I'm sure you don't want to be here till midnight. I certainly don't. So what I did was hone it down to my top 4. And I hope you'll bear with me while I take you through why I believe these 4 recommendations are so important to the industry and important to Naturecan as a company. So I started with the recommendation to redesign the novel food process. And I can imagine that a few people in the industry hear that and are laughing, but yeah, shall I say it's dominated my life for over a year now. I've been completely immersed in it. I've lived and breathed it, and it has not been without its challenges. And I say that tongue in cheek. As I'm sure you can imagine, the process is complex, convoluted, and really expensive. So, I think that definitely this needs looking at. Now, I say that, but I do have empathy with the FSA. I've dealt with them extensively with the 8 applications Naturecan have in at the moment for novel food, 8 different product categories. And, they did not anticipate, nobody did, how many applications they get, and the fact that a lot of those applications would not be of a good standard, but they've still got to be sifted through in fairness to the companies that have applied. And that takes time, it takes resources. And let's not forget the FSA have had funding cuts as well. So, I would say the FSA in the circumstances are doing a pretty good job, and I've found them very helpful. But, bringing it all under one umbrella of expertise and learning from this initial phase with the FSA at the helm, I think has got to be the way forward. And they would have some great experience to offer to the regulatory body moving forward. So I love the idea of this National Cannabinoid Control Authority. And even more than that, I love the idea of the National Institute for Cannabinoid Research. And there's a personal reason there for me, because I'm involved in a CBD research group at doctoral level at Liverpool John Moores. So that's where I spend the rest of my time. When I finish at Naturecan with all of our CBD products, I then go on to my research group on CBD, but it's all good. So yeah, I find that really exciting. And the Centre of Excellence, I just think will be a fabulous move forward. Daniel said before, it will allow collaboration, and it will also allow for the best use of funding for the research that needs doing. So really, really hope that goes ahead. Very, very exciting again. Now, another recommendation that Naturecan see very positively is the whole plant utilization. Now, you may wonder why, because obviously we don't make CBD distillate at the moment. But what we have to do, we have to buy it from the US. We don't have a choice. We can't buy it here. So all of that money is shifting out of the UK when it could be staying within the UK. Now, the government have got to be interested in that, surely. It just doesn't make sense. Another reason that Naturecan are interested in this recommendation is that Naturecan's a very ambitious company, and it's driving sustainability as a core company value. I'll give you an example of that. There's a real will there to use hemp packaging for all our products when we can. Now, clearly at the moment, there's cost implications, you've got to import and everything else. But if we get the industrial hemp available for packaging in this country, that's fantastic. And we will move towards that. It's a really good initiative. And another thing is they've just launched this week, Naturecan launched a planting a tree initiative. So for every order received, Naturecan will fund planting a tree. And we really believe our customer base will align with that mission. We think they're going to love it as much as we do. So yeah, whole plant utilization, fantastic. We really hope that happens. Thirdly, what we'd also like to see is clear export guidance. Now, currently, Naturecan is in 28 countries, and there are challenges every step of the way. And we believe with that clear guidance in place, a lot of those challenges could be overcome much more simply and quickly. So obviously facilitating growth, facilitating the development of the business in those countries. So absolutely, we are on board with that, because we want to be a truly global player in a global industry, and being led by the UK. What could be better than that? So very, very exciting to get that clarity. And then the fourth point I picked out was the enforcement. And again, previous speakers have touched on this. But, you know, trading standards really need to be empowered to work with the FSA, because they're going to have to monitor what is going on in the marketplace. Are there non-compliant products still out there? And they're going to have to enforce, if appropriate, by removal of non-compliant products from the shelves or from online, wherever they're being sold. Now, all of this will drive up consumer confidence, and that is the best way to grow this sector. If consumer confidence increases, the sector is going to flourish, and the consumer cannabinoid market in the UK will flourish. Thanks.
Thank you very much, Moyra, for picking out your top four. It's an incredibly difficult thing to do because it's just so exciting. I can feel your excitement coming through my screen. And I think you're 100% accurate in saying about consumer confidence. If we just think about how much more confident CBD consumers in particular are now compared to the back end of 2017 and early 2018 and all that has happened in that short space of time. So I think the only way is up in that respect, thanks to things like the novel foods regulation as well. So if anyone has any questions for Moyra, just pop them in the Q&A box as we're going along, and I will come back to them after we have heard from the rest of our panelists, if that's okay. So now we're going to bring in Dr. Elizabeth Phillips, who is a CBD expert and neuroscientist. Elizabeth, with your pharmaceutical and clinical background, I know you're particularly passionate about some of the things that Moyra has picked out as well, especially the idea of a centre of excellence from a research and development side in this industry. So do you want to kind of tell us what we might be able to achieve from establishing a national centre of excellence and licensed labs as well?
Lovely. Yes, thanks ever so much, Roisin. And yes, thank you to CMC and ACI for hosting the event, inviting me on board today. So yes, there's a real theme, isn't there, around this research and centre of excellence that's been mentioned throughout the report. And I'm a big fan of this. I think, you know, Kingsley first started touching upon the sort of transparency within the industry, and then we've built around the sort of consumer confidence. But as a clinician that prescribes or recommends CBD products, I still find a huge amount of lack of knowledge. People might know the brands that they like, they might have confidence in the brands, but how does CBD work? What's it useful for? And as Daniel mentioned as well, that there's sort of whole pockets and whole areas that are currently being researched, certainly within the medicinal cannabis, but the CBD side. But what would be really useful through this sort of centre is to really identify some of the key areas, and certainly within my clinic and within the real world data, real world evidence, the anecdotal reports that I get through, we're really looking at CBD around pain, we're looking at CBD for sleep, for mood, for anxiety. So we've got some really key areas, and there are certainly small scale studies that have been released in the last sort of 3-4 years, but these are only pockets, and so to have some cohesive, coordinated group, and I think within this centre of excellence, what we could really focus on well is the therapeutic benefit, because again at the moment we need some research around safety, around toxicology, pharmacokinetics, but actually really understanding as well sort of proof of concepts, preclinical proof of benefit, to really drill down into these cannabinoids. And obviously we're talking about CBD today in particular, but there's a whole host of other cannabinoids as well. And with the universities that Andy talked about, University of Aberdeen, Nottingham, King's College, certainly Moyra was mentioning John Moores as well. They do some great work around sports and CBD, but actually drawing all this together is going to make a much more sort of cohesive platform, and the ability of the UK to really be sort of world leaders in this area as well. So I think generally speaking, from my point of view, I do a lot around education around CBD, around the endocannabinoid system, where cannabinoids function as one of the main systems in the body. I think if we were able to really draw together the great expertise that we already have, but put this under an umbrella organisation, as Steve said, be it online, be it a physical capacity, but have a coordinated event, we will we will get better sponsorship, there would be much better outcomes in terms of trials. Whether we could extend this then into medicinal cannabis areas as well, we obviously then get into the discussion around RCTs, or randomized control trials, versus real world evidence, and how we can look at licensing of more products in the medicinal cannabis space. But to have this cohesive aspect is something that's excited me most about this report. And we're only going to do this by driving it ourselves as well. I think we've again touched upon the fact that, within governments, within certain spheres, still people don't understand the real importance around cannabinoid medicine, and be that in cannabinoids, the consumer products, CBD, or be it in medicinal cannabis products. So, we are at the forefront of the education of the authorities and the industries, but also education of the consumers as well. So that's why having some centre of excellence that we can drive from the front line is going to, I think, really vastly improve and vastly move this area forward.
Thank you very much, Elizabeth. And yeah, it's incredible to see, the kind of promise, I suppose, that we all have in our sentiments when we're discussing this today, and how optimistic we all are based on this report. So thank you again for your answer. And I suppose it's a good point in time now to bring in Ed McDermott of MF Life Sciences. Ed, if I can put the next question to you, please. We focused a lot of today's conversation, obviously, given the survey from Public First and the Green Shoots report from the ACI and CMC on the kind of consumer cannabinoid wellness space. But this report also bodes well for the potential of medical cannabis in the UK, and topics like research and development, enforcement, and also the conversations that we've been hearing from the likes of Andy and Parveen as well in terms of import and export. How optimistic are you for the medical cannabis space in the UK going forward as we kind of emerge from this year of kind of recovery and shutdowns and recovering again? Are we on a similar kind of pathway to an upward trend in medical terms?
Yeah, absolutely. I think through the pandemic, obviously there's been a lot of challenges as anyone would expect with any business. But actually what it's also done is led to a great deal of opportunity in terms of the way that care and medicine has been delivered to patients. So telemedicine has been a major change for the cannabis industry. Historically, it was very, very specific. You had to go to a, more often than not, a private Harley Street based doctor and have an appointment wherever you were based in the country. What it's done is opened up, a far greater population of the patients to accessing medical cannabis. On top of that, you've had companies like ourselves and a number of other companies who have effectively built a framework of facilities, of supply chain and capability in order to be able to deliver products to patients in this very new framework that we've had to build post rescheduling of cannabis as a medicine. So if we look at, and again, I'll talk some numbers here that I can speak with a relative amount of authority on. Up until about a year ago, typically each month we were seeing around 50,000 unlicensed medicine prescriptions, i.e. specials medicine as they're called. A few of those lines have subsequently become licensed, which has meant that number has dropped to around 35,000. Of that 35,000, you're looking at around about, on the current run rate, about 5,000 plus medical cannabis prescriptions per month. So directionally about 15% of the specials market. Granted, it's a very small part of the pharmaceutical industry, but it shows that there is growth, even with the challenges that patients face in terms of being a self-pay model without the support of the NHS. So I'm absolutely confident that over the next year or two, we could see that entire specials market number eclipsed by cannabis prescriptions. Now, it doesn't serve the long-term problems that the industry faces. And of course, many of the points raised in this report and set of recommendations helps to address some of the longer-term problems. But I think we also have to be very careful about sort of conflating all these different verticals together. CBD wellness as a over-the-counter consumable product, nutraceutical product, for want of a better term, needs to be dealt with somewhat separately to medical cannabis, in the same way that medical cannabis and pharmaceutical products, i.e. market authorized products, are very different things as well. Now, each part of that industry, of each company, shall we say, that operates in those verticals has to really work hard. They have to spend money. There are barriers to entry, and that's an important thing. But that also, in my opinion, gives great opportunity for investment to get behind the industry, because it is unique. And I think we are all absolutely agreed that the UK could become a real leader in the field of pharmaceutical medicines, market authorized products, medical cannabis, and CBD wellness products. So I really do think we've got an incredible future ahead of us. But we have to be very, very specific. One thing I personally have been very frustrated by is when sitting down with policymakers to try and effectively depack the industry in the often very short space of time that they give us is very, very frustrating. So I feel like the industry actually is putting its best foot forward on almost all fronts of all those verticals I mentioned. We are making great progress. The numbers are quite significant. It's going to be very difficult to get each player within the industry to come together and start sharing data with one another, especially where private investment has got behind these individual companies. So there's an element of sort of IP and knowledge sharing that companies aren't going to want to do. So this could be part of the solution, but certainly there's a number of these recommendations that I think could help drive this business forward, drive the UK forward as a major player. And I certainly feel like that everything is moving in the right direction despite the challenges of the pandemic.
Thanks, Ed. And I think that brings us on really nicely to our next kind of topic. Wilson, partner of Crystal Capital Partners, here with us as well this afternoon. And Kingsley, there's no question over how attractive the cannabis wellness or the medical cannabis kind of spaces are from an investment term, I suppose. But what are the bottlenecks or the barriers to getting investment into this category and into this space?
Yes, thanks very much. I mean, you know, that's an interesting question, because we've been looking at the sector now for the past 5 years and helping our clients deploy capital in. And, you know, the report that we've heard about today talks about the operational considerations, the regulatory considerations, how you get consumers to buy more of this product. But remember, behind all of that has to be the infrastructure and the companies, and those companies have to be fueled by capital to create a large and vibrant industry. You know, we can look at all the reports of where the CBD market could go, the size of the medical market, all the R&D that has to happen, and some of the licensed products that can come. But that entails hundreds and hundreds of millions of pounds of investment. And we only have to look over across sort of North America to see what happened there as the industry emerged. It was really small family offices and small retail investors and friends and family that were fueling that industry. And it took it quite a long time to sort of bubble up until the serious capital came. And so I think, you know, where the report needs to also consider, and where key stakeholders in the UK industry need to consider, is how do we make this market more open and more acceptable for investors to deploy into these companies? Because there's no shortage of companies on the CBD side, on the medical side, and on the pharma side. But you know, each one of those companies, you know, needs working capital for CBD. They need to brand and market. The medical companies need to get supply of product in. They need to kind of create the networks and chains. Obviously, the pharmaceutical focused companies need to spend a lot of money on R&D and on sort of getting through the clinical trials. And so where we sit in the market, you know, we've probably deployed north of 200 million pounds of our investors' capital into this sector, but most of that has been outside of the UK for some of the reasons we're discussing. And the biggest issue is this uncertainty around the sector. And that's what's putting investors off. They're not getting comfortable enough to actually feel like they really want to deploy larger tickets into the market. And you know, a lot of people came to us 18 months ago and said, hey, look, you know, I put in some money into the CBD company, and now they're telling me that there's a new change in law, a new regulation, there's something called novel foods, and we have to go and now raise even more money just to get through the gate to be able to sell the product we thought we were going to be able to sell before that came in. And so it's surprises like that in the market that I think are putting investors off and concerning people. And when you actually look at the numbers, you know, by our calculations, I'd say there's probably been less than 150 million pounds of private capital that's gone into the UK medicinal cannabis sector. If you look at the public markets, which have just opened up, I think at last tally about 45 million has flown into, you know, cellular goods, Cannabis, Zoetic, NGC Pharma, and I believe on Friday, Oxford Cannabinoid Technologies list as well. So a little bit of money's flowing in on the public side as well. But again, it's this general level of uncertainty, whether it's individual investors, whether it's sort of big private capital guys or the public market investors, the uncertainty around all of this and some of the key things we've been discussing today are going to be critical factors that need to be addressed. So in terms of what are the solutions, well, of course, trying to remove these barriers of uncertainty that we're seeing at the moment will help smaller investors get more comfortable that the deals that they're going to go into for a few £100,000, you know, are going to progress in the manner that they thought they would. Then on the private side, we need larger private equity firms that can write growth capital size tickets, 5 million, 10 million pounds. And that's something that we're working on here at Crystal. We're looking to launch a fund on the public markets after summer to raise 150 million pounds. So we can write growth capital tickets into these emerging businesses that are showing all the right KPIs and progressing in the right manner. Then on top of that, you know, I think the public markets, although we've had the SCA allow cannabis companies to now start to list last September, and as I said, we've got 4 or 5 that have come, even AIM, which is, you know, bills itself as the growth capital market of Europe, hasn't yet had a cannabis company come. And so there are regulatory issues that they're worried about. So again, it's educating a lot of the stakeholders around some of these uncertainties that needs to happen to unbottle. And then I think finally, it would be interesting and very supportive if the governments were to think about setting up a public-private fund to actually make some of the changes that are being recommended, but actually to potentially put up some capital that would sit alongside the private capital that we bring to, again, invest into the sector to show their support and their faith. They do that in other sectors. They do that in technology and fintech, and they match fund investment into the sector. And I think, again, a push towards getting the government to actually support the sector and to grow it across the wellness, the specials, and the pharmaceutical side would be another strong step in the right direction. I appreciate it's going to take time, but all of these things, I think, need to piece together to provide the fuel that will then help all of these sectors grow in the UK over the next 5 or 10 years.
Yeah, some really good points there about the various kind of barriers at different levels, I suppose, of investment as well, from your £100,000 to 5 or 10 million pounds. Is this unique to cannabis, these kind of barriers and these kind of bottlenecks that you talk about? Is this unique to this space from an investment point of view? Or you mentioned, technology and fintech sectors as well. How have those kind of sectors overcome such barriers in the past?
Yeah, I think it is fairly unique because it is so complex. From any investor's perspective, you've still got to unpick whichever company or sector it is this the right management team? Is it the right strategy? What's the competition like? And that's no different in cannabis. But then on top of that, you layer all sorts of these sort of regulatory uncertainties. And of course, across Europe, every country is very different in terms of its evolution. Having gone legal, what then happens? How does that infrastructure build out? So I think cannabis is different, and it's going to take a little bit longer unless we get everyone galvanized behind it. Just to give you a sort of bit of context, in technology, institutional ownership is about 50% of the sector, and that's a trend that holds true for most more mature sectors. In the the medical cannabis sector, institutional capital is less than 5%. So how are we going to swing that pendulum from 5 towards 50? It's going to be unpicking, solving some of these grey uncertainties that sit above the normal investment analysis that you do into any normal company.
Thanks very much for that. And I think if I go back to Moyra, who kicked off this panel discussion talking about Naturecan and its success in 28 different markets around the world. Moyra, from just bringing it back and tying it all back into the Green Shoots report that we're all here to celebrate and talk about, if you had to pick one key recommendation going forward from this report that you were particularly excited about, what would that be? What would be your top priority?
You're just making me pick one. Okay, well, I would have to say, I think, given Naturecan's stance on sustainability and ambition with sustainability, I think the whole plant utilisation is going to really help push that along. And, it's something very exciting. I think if we can get the UK really using the whole plant and all the economic benefits as well as the health benefits from doing that, it's only got to be good for everybody.
Yeah, I think I agree. And Elizabeth, if I can bring you in on this as well and ask you the same question, from your point of view and your expertise in research, what really excites you about this and the future of the cannabinoid space?
Well, it's going to be the R&D side. It's going to be something around the Centre of Excellence. We're in a very unique position within the cannabinoid sphere, again, whether it's consumer cannabinoids, whether it's medicinal cannabis, in that research is playing catch up. Normally with pharmaceutical research in my pharmaceutical industry days, you know the target, you then design the drug. The thing is medicinal cannabis, cannabinoids have been around for thousands of years, but we've not really known how they've worked in the body or, sort of got the evidence around, sort of population benefits. It's very anecdotal and, when we're pushing towards real world data. So really, I feel, a large part of this needs to be around understanding more in the cannabinoid medicine cannabinoid science sphere. So the R&D side, setting up a centre of excellence, we've got a coordinated approach. We can push the UK as this, sort of world leaders in this area. And so this really has to be, for me, one of the most exciting points within this fabulous report. So.
Thanks very much. And Ed, top priority for you from the medical side?
I think in the context of this report, there are lots of other priorities that we have that aren't captured in the report, but I would say export would be a major change for us as an industry. I think it would actually go to addressing a number of different points, including what Kingsley was just saying about institutional capital coming in to get behind cannabis companies, particularly medical cannabis companies. Being able to export would create a lot of jobs. It would give comfort to a lot of institutional investors that there was scale while we continue to build our own domestic market here. So I think that would be a very important thing to see.
Thank you. And Kingsley, if I can put one more question to yourself. We've got a question here from a viewer who is asking about payment gateways. And is there a recommendation from your standpoint to regulate and support CBD business going forward?
Sorry, can you just repeat that again? You cut out.
Oh, apologies. In terms of payment gateways, as being a barrier for a lot of kind of companies in that respect, and a lot of CBD companies in particular in the past, that was definitely on your list of bottlenecks or barriers earlier. If you could just go into that a little bit.
Yeah, unfortunately that remains, and that's a global issue. In the US, they're trying to resolve that through the Safe Banking Act and putting in place lots of initiatives. So in terms of payments and processing, it's really hard even for companies setting up to get bank accounts, or actually if they have a bank account set up, to not get it closed down. We've seen lots of examples of companies that have had to move banks several times, which is obviously time consuming and not where you need to focus. There are going to be some innovative ways and businesses actually that we've looked at that are going to try and solve these payment issues and how you can get around it. I mean, we've looked and seen all sorts of models around cryptocurrency and sort of more techie type solutions. I don't think that's the natural solution. I just think, again, it's more pressure on the government to say these are legal businesses. We all know that they are. Can you now educate the banks? And we're having this discussion actually down in Jersey. One of the companies we funded down there called Northern Leaf was struggling with getting bank accounts and actually taking payments. And so we sat with the government there and actually got the bank then to mandate down to Lloyds and other such banks to allow them to sort of say, no, this is okay, you're not going to run into issues. So it's a very tricky, picky situation, and I don't sometimes think that'll change quick, because to go through the systems of big banks and payment solutions, it's just going to take time for people and consumers to react to that. So it's difficult, and I don't have the magic bullet at this point in time, and not many of the companies do. You've just got to be slightly clever in terms of how you think about it and what you actually write on your bank balances and pay slips.
Ed, do you want to come in on that?
No, it was more of a comedic view. Just conflating cannabis and Bitcoin, for example, I don't think would be a great. That could hamper things rather than push that forward. But I think Kingsley.
I've seen about 15 business plans of how people are solving these, and it's incredible how innovative people are going to be. But then those Bitcoins were based off some sort of algorithm from AI, and before you know it, you don't know where you are. So those aren't going to be the solutions, I'm afraid.
The good news for the fintech industry in general, and for cannabis as well, though, is that the banking system as we know it, the high street banks, make it very, very easy for fintech to progress very, very quickly. So I'm sure we're going to see lots of good solutions as time goes on.
We've got another question here just before we come to our closing comments at the end of this session. We are a little bit over, but we did start a few minutes late just to allow more people to join us this afternoon. So Ed, if I can put this question to you, in terms of this report, the Green Shoots report, and the figures in terms of CBD from the survey conducted by Public First, is there anything you think is missing in terms of recommendations? What kind of gaps do we need to be looking to fill?
look, I think it's very, very difficult to put every single point that every single industry player, every single scientist, etc., is going to want to see in a report. It's, you know, it's almost impossible to kind of tick all the boxes and make everyone truly happy. I think it's, you know, on balance, it's good. You know, I just want to make that clear. But, you know, very specifically for a company such as ourselves, where we've spent tens of millions of pounds, we've hired, you know, north of 100 people to allow us to affect our supply chain very well in the UK, and subsequently we have become the biggest, if not, well, one of the biggest, if not the biggest player in the UK market. You know, one issue we do have is, for example, around the licensing that we have. Cannabis is treated very, very specifically, and in some respects the report deals with this, but there are elements of the way that we are still, even though we've obviously qualified and have been entrusted with those licenses, we're still to some degree hampered and not allowed to wield them as we should be able to, as we would be able to with any other product. So, but again, those are very specific points that sort of carry with them some nuance. So those are things that we as a company lobby for individually. But again, yeah, just the very nuanced points. But as I said, I think it's very difficult to include everything.
And that's the point, isn't it? We're not, no one's work is done. You know, it's constant growth and constant development and constant progress is what we're all striving for, I think, to create a legitimate cannabis space, whether you're on the wellness products, the consumer cannabinoid side, or the, you know, specialist kind of side of medical cannabis, which I think is very true to say.
Absolutely. And look, I think, you know, it's been a very difficult year for every industry. It's been a very difficult year, I can imagine, you know, if you're a policymaker, because, you know, God, the journey ahead looks pretty tough at the best of times, and dealing with something that is really still such an embryonic piece of business in the UK, which is the cannabinoid sector. I believe it's going to become very, very big, but really we're still right at the beginning of this journey, and, you know, trying to get policymakers and regulators time to deal with all these complex issues, which we all know as an industry are going to lead to much greater revenue, much greater patient access, much greater research into the product, into the cannabinoid profiles themselves, and ultimately are going to be things that will really help drive innovation, tax revenues, employment when we most need it. It's, you know, it's very hard to get their attention and depack what is a very complicated space. So, we are going to all have to keep working, you know, the crazy long hours and long weeks that we do. But, you know, it will be rewarding all round for everyone, I think, in the end. You know, it's very rare that you're in a situation where, you know, patients will benefit, the population in many ways will benefit, the HMRC will benefit, science will benefit. It's very, very rare that you have that kind of situation. And at the same time, we get to wrestle what should rightfully not be a black market issue back into the hands of proper companies that care about the people that are ultimately consuming their product, whether it be a pharmaceutical medicine, a medical cannabis preparation, or a nutraceutical product.
Absolutely, absolutely. Fantastic. And I think it is there that we will leave it for the afternoon. Thank you very much to all of our panelists who took the time out this afternoon to share your knowledge and expertise and insights with us. Thank you to the ACI and the Centre for Medicinal Cannabis for arranging today's event, and for bringing this fabulous group of people together to really, you know, share their knowledge base, and so the rest of us can learn and hopefully make a plan for the future. If you happened to tune in midway through any of our sessions today, you'll be able to access everything on demand on the ACI and CMC websites after the event. And I think what I would say as the chair as we close this event is that I think I speak for everyone when I say that as we emerge from the past year or so, it's over a year now, isn't it? Which has been a very difficult period in time and in history, from an economic point of view, from a social point of view, and in the case of our healthcare system also. The future of the cannabinoid wellness and medical sides looks incredibly promising. And I know we will all continue to do our part in furthering the case for a combined legitimate cannabis space in the UK. So thank you to everyone for taking the time. As I said, thank you to the ACI, to the CMC. We'll leave it there. And if you have any queries for anyone involved today, you can find all of the team members at the ACI and CMC on the respective websites as well as the Green Shoots report in full, which I highly recommend you download. So thank you very much for having us. We'll leave it there, and good luck to everyone as we move forward together in this very exciting space.
Okay.
Well done, thank you.